meet their new wife or husband.
So far, they've partnered with several organizations to help the formerly incarcerated. They've released multiple PSAs and a documentary about suicide prevention and offer financial support for those impacted by suicide and violence. Maxie says nothing will fill the void of losing her son, but she hopes her work will help other mothers avoid what she went through.
He was someone I wanted to see and had so many plans and expectations for. And I love him with every being of my soul.
Walter Morris for BNC.
Indeed, a heartbreaking story. And joining us now is David Johns, Executive Director for the National Black Justice Coalition. David, thank you for joining us. This is a very important subject matter. As we saw in Walter's piece right there, mothers and fathers, they're crying for their loved ones who have taken their lives. What do we do in the black community to strengthen our young men and women and to protect them and help them prevent suicide?
First, let me say thank you for having me and making space for this important conversation. And we start by telling the truth and naming things for what they are. So I'll lead and name that I'm struggling in this moment because I was touched by everything that Jamal's mother said. Having taught kindergarten and third grade, having holding space for Nigel Shelby, a 15-year-old boy who died by suicide after being bullied in Huntsville, Alabama. What I know is that children don't ask to be born. And to think that for them, some things are so challenging that they consider that their only option. I acknowledge the failure on our behalf as caring and concerned adults to do better for them, and really struggle with knowing that there's so much more that we can and should be doing. All of us should have heard the stat that was shared several times. I want to underscore that this is particularly problematic in the black community because suicide rates are increasing for black babies while they're decreasing for every other community of children. There are special concerns for children under the age of 13 and a special concern for our girls. Black girls are committing suicide at twice the rates of black boys. All the rates that anybody will be able to cite are even more exacerbated for kids who have intersexual identities and who otherwise identify as queer, trans, or non-binary. And if each of us are more thoughtful about the challenges that they face as a result of white supremacy and anti-blackness, the challenges that kids face now as a result of insecurities exacerbated by COVID, and the challenges they face as a result of things like poverty or toxic stress, we can be better at intervening when they show signs of struggling with mental illness or depression or anxiety. We can be better at connecting them to care. And there are also opportunities for adults in positions of leadership to shift systems so that families and children are better able to access the supports before they need them.
David, what are we missing in the signs of how our children are struggling? Is it that black and brown communities rely too much on that bootstrap yourself up mentality? What is it?
Yeah, I don't think that that's it, right? And it's really important for us to start conversations celebrating assets. I think that what it is to that point is that we face more challenges than other communities do as a result of white supremacy and anti-blackness. We know that black people are more disproportionately inclined to be working in positions that have been affected by COVID. They're more likely to be experiencing unemployment or housing insecurity and food insecurity. Those things lead to mental health stress and trauma. And in the absence of existing supports, in the absence of meaningful relationships with competent and qualified mental health providers and other systems of care that include faith-based communities and religious support and community networks that give us opportunities to experience joy and to frolic, we are more susceptible to buckle under the trauma that all of us experience simply as a result of being human.
You know, David, that's so appropriate and right about what you're saying. We literally have boys and girls dying to ask for help, and we should be helping them live to get the help that they need so desperately in crisis management at such a young, tender age in terms of what they're coming up against, especially in the midst of the pandemic, which has caused a greater epidemic of anxiety and stress. So tell us, how do we help our youth get through this?
One, we model the importance of identifying mental health challenges that we all experience, as well as seeking the support to address it. Two, we all become better acquainted with resources and source of supports. There was a national suicide prevention hotline mentioned. Our good friends at the Trevor Project operate a hotline specific for LGBTQIA+ youth. And so there are system changes that we can all pursue. And also want to celebrate the leadership of Congresswoman Bonnie Watson Coleman, who is attempting to focus federal attention on all of these efforts. And her efforts also include increasing the number of competent and qualified mental health practitioners who are not only Black but understand the Black experience in its beautiful diversity, and also are doing work to decrease the barriers that we face when we try and access mental health services and supports. That has to do with everything from where they're located to who's providing them, and then who's covering the cost.
David, how can parents help their children, in particular young Black girls, deal with social media and bullying, both of which are now factors in higher suicide rates?
Yeah, that's a really important question, and I want to first acknowledge the responsibility that content providers have for moderating content to ensure that we are limiting the exposure to things that would otherwise facilitate or support our babies doing anything other than thriving. The second thing that I think is important for us to acknowledge is that young people are often more experts using technology than the adults around them. And they find sophisticated ways to overcome the simple traps that adults set for them, thinking that they're not going to access sites that exist. Which leads me to my last point, which is that it's really important for us to have honest and brave and fact-based conversations with young people that acknowledge that they are experts in their lived experience, that they know very well what makes them happy and what makes them sad. And if we hold space to regularly check in with them, to ask them how they are doing, what they're doing to experience joy, how they are responding to things like systemic racism and white supremacy and anti-Blackness, how they're dealing with the uncertainty and instability that the novel coronavirus has engendered. I think having those conversations go a long way at reducing anxiety, at providing opportunities for us to check in and acknowledge when there might be opportunities to intervene, and otherwise connect kids to sources of care such that they have support before a moment of crisis calls them to need it.
David, we can't thank you enough for joining us to share those insights and perspective and model what we can do to teach our children that they are young, gifted, and Black and should never give up on what they can contribute to their lives. And we have to be responsible in helping them understand that. David Johns, Executive Director for the National Black Justice Coalition, we thank you so much for joining us to talk about this all-important matter. If you or someone you know is in crisis, call the National Suicide Prevention Lifeline. There's the number for you right there. It's 1-800-273-TALK, or visit suicidepreventionlifeline.org.
And coming up, we take a look at the tragic problem of world hunger and what the United Nations and other groups are doing to solve the problem in Ethiopia and elsewhere. That's next on The World Tonight.
Closed captioning brought to you by Nutrisystem. Lose weight and get healthy with meals delivered to your door.
Introducing the all-new Nutrisystem.
Now with a breakthrough drink mix that will burn body fat and help you stay hydrated. Order your Nutrisystem plan and get the fat burner free.
Imagine a world where we have the tools to sell things that mean something. Like a sunscreen made for melanated skin that blends in. Prove that things don't have to be the way that they've always been. The world's been waiting for what you do.
Hi folks, Joe Namath here with a new message about your Medicare benefits. You may be entitled to transportation, meals, and expanded coverage for dental work that includes extractions.